Hi, this is Andrea Kane, and I'm here with you for HSC 114 Medical Terminology, where we are studying the language of medicine, 12th edition by Davy Ellen Chabner. You are still on week 3, but now we have moved on from chapter 5 to chapter 6, where we're going to talk about some additional suffixes and digestive system terminology. If you are following along in your book, this is on page 177. It gives you the chapter goals here from the book's perspective about some suffixes, lab tests, clinical procedures, abbreviations. And so let's get started. Some suffixes they want us to know are ectasis and ectasia, emesis, pepsia, phasia, plasty, ptysis. Ptysis. Watch out for that kind of silent P. You have rage and ragia, raphi and rhea. And all of those have RRH at the beginning, so watch out for that. Spasm, stasis, stenosis, tresia. Some suffixes that can be used alone as separate terms, all by themselves, to mean something are emesis, lysis, spasm, stasis, and stenosis. So those don't even need to have a combining form. They can just be used alone. Which term means difficulty in swallowing? Difficulty in swallowing. And remember I talked to you about this last time. What's the difference between the S and the G when it comes to phasia versus phagia? So watch out for that. Which term means to control or stop bleeding? This means to stop bleeding. You need to know the word for blood, and you need to know the word for stopping. Combining forms. You have buco, cico, cilio, kilo, coli, cholangio, cholecysto, and cholodoco. Colo and colano, watch out because there's 2 for colon. Denti, we talked about in chapter 5 because it has a combining vowel of I. Duodeno, entero, esophago. Gastro, gingivo. Glosso, gluco, and glyco, meaning sugar. Hepato, hernio, ilio. Jejuno, labio. Linguo, lipo. Litho, odonto, oro, palato or palato, depends on how you're pronouncing and what else is coming with it. Pancreato, procto, pyloro, recto, sialadino, spleno, stiato, stomato. Which term means enlarged liver? Well, we talked about how you needed to know the combining form for liver, hepato. Hopefully that will help you with this. Lab tests. Some of the lab tests you might run across are clinical procedures, usually meaning radiology, that you might run across in the digestive tract system or GI system have to do with amylase and lipase, those enzyme tests, and they do that through the blood. Liver function tests, again, looking for enzymes and bilirubin in the blood. Stool cultures, you're looking for microorganisms. And when you do a stool Guaiac test or hematocrit test, you're testing to detect blood in the feces. So you'll oftentimes see that that if there's a black stool, they'll want to test it for blood. And even if it's not black, sometimes they need to do that test just to see. Usually with black stools, you can pretty much guarantee there is some type of blood in there. But sometimes they just want to test a regular stool to see if that's something that's in there. Another quick quiz. Which of the following tests for clear fluid that remains after blood has clotted? Okay. Which of the following tests will test the clear fluid that remains after blood has clotted? It's a serum test. Well, you know right away it can't be stool, because stool is obviously feces. So A and C are out. So that leaves LFTs, and you have to know what LFT stands for, and I'll give you a hint, liver function test. So that should help you with this one. All right, clinical procedures, mostly let's talk about the radiology part of life. There are tons of x-rays that can be done with and without contrast. There are CT scans. There are ultrasound procedures that can be done. MRIs. There is something called a HIDA scan. This is a nuclear medicine test. So that involves a radioisotope of some type. Other procedures, and these are surgical procedures, as you can tell. They may or may not be open surgical procedures, but they're surgical procedures, or considered invasive is the word I was looking for. Gastric bypass or bariatric surgery, GI endoscopy, laparoscopy, liver biopsy, nasogastric intubation, paracentesis or abdominocentesis. It's usually paracentesis. I rarely see it as abdominocentesis in the medical field. Which procedure is a surgical puncture to remove fluid from the abdomen? Surgical puncture to remove fluid. If you go back here, that should help you. What is a puncture to remove fluid from the abdomen? I bet you can get it now. All right, abbreviations. I'm not going to talk about any specific abbreviations, just would ask you to be familiar with some of these. If you end up in the GI field, you will become very familiar with most of these. I would say some common ones that you would want to know have to do with BM for bowel movement, CT for computed tomography, EGD is very common, and ERCP. Those last two are definitely used in the field on a regular basis. G-tube, GERD, GI, IBD, J-tube, LFTs, those are all very common ones. MRI, NASH is a very common one. NG-tube, NPO, PEG tube, PEJ tube, those are very common ones. PUD, I see quite a bit of. TPN, if you go in as a dietitian, you'll be involved with TPN. T-tube, again, very common. Suffixes, ase, centesis, chesia, ectasia, ectasis, ectomy, emesis, emia, genesis, graphy, iasis, lysis, megaly, orexia, pathy, pepsia, phagia. Prandial, plasty, ptosis, ptysis, rage, ragia, raphy, rhea. Scopy or scopy, spasm, stasis, stenosis, stomy, tomy, tresia. And that is it for chapter 6. So have a great rest of week 3. I'll be back for week 4. We're going to just focus on one chapter in week 4. So that'll give you a bit of a break, although it is a big chapter. All right, take care.